Hello, my name is Dr. Diwan S. Raja. Today I will discuss about Barnard-Soulier syndrome. What is Barnard-Soulier syndrome? This is an autosomal recessive disorder in which the platelets are large and defective and unable to interact with von Willebrand factor. It is caused by an inherited deficiency of the platelet membrane glycoprotein complex 1b to 9. This glycoprotein is a receptor for von Willebrand factor and is essential for normal platelet adhesion to the subendothelial extracellular matrix. Barnard-Soulier syndrome illustrates the consequences of defective adhesion of platelets to subendothelial matrix. So, what is the clinical presentation of Barnard-Soulier syndrome? Clinical presentation: the classic finding in Barnard-Soulier syndrome include epistaxis, that is bleeding from the nose, easy bruising, swelling, mucous membrane bleeding, perioperative bleeding during operation, even after operation, postoperative bleeding, menorrhagia, excessive menstrual blood, ecchymosis, there is a bleeding under the skin, and gingival and gastrointestinal bleeding may occur. So, bleeding may be from gingiva, from the gastrointestinal system. Bleeding may be intermittent and unpredictable. So, it is not constant. It is not always constant. It may be intermittent and unpredictable. Diagnosis: patient history is very important. Description of clinical bleeding symptoms. Okay. Exclusion of von Willebrand disease. In von Willebrand disease, platelet morphology is not changed. Their aggregation is good. Also, von Willebrand antigen is present. Platelet count and investigation of blood smear may provide a tentative diagnosis. Usually, platelet count may be usually normal or lower than normal. Light transmission aggregometry is still considered the gold standard modality for assessing platelet function. In summary, laboratory test shows a low platelet count, large platelet, faulty platelet adhesion, poor aggregation with the ristocetin. Okay, this is the histopathological image. This has been taken from Google. We are looking at the large platelet. Defective platelet. Platelet is unable to touch the von Willebrand factor and unable to go into the subendothelial matrix. Okay, we got that. These are all RBCs. This is platelet, very large platelet. Treatment of patient with Barnard-Soulier syndrome generally is supportive, with platelet transfusion when absolutely necessary. Avoidance of antiplatelet medication like aspirin or aspirin-like medications, recombinant activated factor 7 and desmopressin. Desmopressin is same as the antidiuretic hormone derivative things. Okay, desmopressin has been used to shorten the bleeding time. This is vasoconstrictor. And that's all about the Bernard-Soulier syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.